Good evening, everyone, and welcome. My name is Dr. Dorian Miller. I'm the director of the Center for Community Health and Vitality, and on behalf of the University of Chicago's Urban Health Initiative and also the Institute for Translational Medicine, I'd like to welcome you to our community grand rounds this evening. Our title is Where is the Love? Lack of resources for our brothers and sisters in the LGBTQIA community and communities of color. We've got a great panel this evening, and so before we dive in with our presenters, I just wanted to provide you with a little bit of information. We've been doing this series of community conversations called Community Grand Rounds since October of 2010, and have had a variety of topics over the years, and this is one of our more popular topics because it's February in Chicago. Even though we're starting to do some of our meetings in person again, we decided to do this one virtually. And so I'm going to suggest to you that you please leave your microphones muted until we get to the end of our presenters. And also, if you have questions along the way, to drop those questions into the chat. We'll monitor them there, and then we will ask those questions of our presenters when we get to the question and answer period. In addition to thanking our sponsors for this series, the Institute for Translational Medicine and the Urban Health Initiative at the University of Chicago Medicine, I'd also like to thank our community consultants who come from neighborhoods from all across the South Side of Chicago, places like Clarice and Associates, Greater Auburn Gresham Development Corporation, Gary Comer Youth Center, and others. And I know I'm missing a few. I apologize if I am, but wanted to say to you, thank you for your continued support in our programs. The Community Grand Rounds programs are actually developed in partnership with our community partners, and they're the ones that pick the topics for presentation, in addition to giving us support with finding speakers for the topics. And so without further ado, I will introduce our first panelist for discussion. Terry Dudley is on the line, and Terry is going to talk a little bit about spatial stigma and where is the care in addition to the love on the South Side of Chicago. Terry, you ready?
Yes, I am.
Wonderful.
Okay, so if Natalie, do you want to pull up my slides for me? I think that'd be easier to just talk through them. Thank you so much. It's so good to see everybody here as we are getting started. I'm just so happy to see so many familiar faces. A little bit about myself. My name is Terry Dudley. I have worked in public health for the last 10 years with a focus in HIV and youth development, sexual reproductive health, and so many other things. But what I'm here to talk to you tonight about is spatial stigma. So it's a lot of information in this presentation, and I'm just going to talk through it. I'm not going to read everything verbatim. I welcome so many questions. This is something I'm really, really excited to talk about. So let's talk about what spatial stigma is and where it's the care on the South Side. So a little introduction. This is talking about basically the impact of spatial stigma on LGBT people and individuals living on the South Side of Chicago. Today, I want to explore that concept with you all, and I want to talk about how that manifestation in urban areas like the South Side of Chicago and its specific effects on an LGBTQ community of color, and specifically Black folks as well. We can go to the next one. Okay, so really quickly, a quick rundown. Spatial stigma refers to negative stereotypes or prejudice and discrimination associated with a geographical location. It involves basically social de-evolution of spaces, and it bases it on characteristics such as race and social economic status. I am someone who was born and raised on the South Side of Chicago. I grew up in the Bronzeville to Washington Park neighborhood, and I have definitely seen these effects in what they look like, especially when we think about cultural identities and who's allowed in these spaces. So this just really talks about like my other side talks about spatial stigma on the South Side of Chicago specifically, and what are some of its factors. Some of the stuff, and we'll talk about my research a little bit later, but some of the things I've found through just my work and research has been a lot of stigma is due to the high crime rates, and we'll talk about what those crime rates look like compared to other neighborhoods, but poverty, and also a lot of racial segregation. If you know the history of Chicago, you know the history of redlining, then you know that this city is very segregated, and the stigma is perpetuated by the media and its portrayal of our history and some of those historical narratives that cause those systematic inequalities. A lot of this then trickles down to LGBT individuals who are on the South Side of Chicago who might be experiencing some of those additional layers to stigma that now you have to introduce their sexual orientation or a lot of times gender identity. All right, we can go to the next one. I'm sorry if I'm going a little fast, but I know we got some more people and I want to make sure we get to those lovely people too. So I'm kind of going through it. But anyway, so some of these ways, these things can kind of like a lot of spatial stigma, like the manifestations of it looks like limited access to resources. So, in my experience, I've seen it as a lot of the resources that are given to people who are LGBTQ plus on the South Side of Chicago. They do not look the same. They are not given in the same way, and those spaces are not accessible or affirming. And it's not because they don't try to be, it's because the resources aren't given in the same way. You know, I think that in my experience, I've worked in some of the largest LGBT nonprofits in the Midwest, and I've seen where they have billion dollar buildings on the north side of the city, while they have not built anything on the south side of the city, and they choose to move into older buildings and try to revamp them. But because these buildings are also old, they already come with its own issues. Um, and that's just a small example of like a very geographical, like visual way of looking at how that stigma looks. Some of that looks like social isolation. This looks like a marginalization within these groups. So both the non-LGBT community, but also people who are LGBT, because those resources don't just help one set of people. Those resources actually are plentiful for everybody. And there's a lot of fear of violence. A lot of this presentation, we use communication skills that will be demonstrated in lectures or like research, but a lot of that has been talked to the research that I have done with understanding what happens when youth have come in contact with these spaces on the south side and on the north side, and what their experience have been. All right, we can go to the next one. Okay, so some impacts I found was definitely impacts on mental health. So there was definitely high increases of stress and anxiety. When we think about spatial stigma, it can have a profound effect on just someone's well-being, and especially people already are feeling as targets. Consistent exposure to this stigma and discrimination definitely contributes to a chronic level of stress and anxiety. Oftentimes, when I hear terms like safe spaces, I question those because even though the first time I experienced a youth space, I experienced it going through the back door in the name of my own safety. And I talk about that story a lot because it brings the question to what made me feel safe as a young Black boy from the South Side of Chicago, and now as a queer, non-binary individual who experiences resources and also has a privilege of giving people resources that definitely sometimes can be re-triggering, you know? So I definitely take that into account when I'm like letting someone know that you can go to this space and you'll be able to receive these services, but you might have a better chance of going to this other space, but you might have to deal with like this community, you know? Um, And I don't think that that's the fault of a lot of the agencies as well. I think that a lot of agencies do the best they can with the knowledge that they have, but knowledge continues to evolve. Another thing is the depression and isolation was something that was interesting to experience and like understanding how stigma attached to a space can make you feel those feelings of rejection and or alienation. A lot of times from the research I've had, I've heard people say, well, this isn't my neighborhood. I only come here for my resources, or this isn't for us, or, we're going to take back this space because we belong in this space. And that can lead to high experiences of violence, harassment, and even stigmatizing those spaces that leads to like that long-term trauma or even PTSD and experiencing some of those communities and spaces as well. And I see it a lot in people of color and a lot of Black people who have had these trauma in these spaces. Okay, we can go to the next one. So some strategies for addressing some spatial stigma is definitely community empowerment. It's super, super important. I'm always saying that the more LGBT people are integrated into community, not just working at your nonprofits, but working at like grocery stores, working at your banks, your teachers, and advocating for their rights and creating those inclusive spaces. I think that's really important because a lot of time in the community that I work with, they are only allowed to thrive and work in these nonprofit spaces. And we have to create those spaces like for everybody in every space. I think a lot of times there's a lack of education and awareness. I think that there is a stigma attached to the South Side that Black people are too homophobic to allow that education to have that space. And I'm from the South Side. I have family from the South Side, and they love me. We have these conversations, and I think that that is a direct cause or effect of spatial stigma. And I think that we can use a lot of it to help promote some of the empathy and understanding. I've heard a lot of parents say, well, I love my child, I love them, but I never had anybody talk to me about like transgender rights or, my parents said this and I always grew this, but I don't have a safe space to say, is it okay to talk about this? Or is this offensive to say, not in my community? And, that's something I want to help promote as part of some of these strategies. Policy changes. So I am a policy student at the UIC, and I definitely advocate for policy changes that really need to address a lot of systematic inequalities that come to promote like equity amongst like inclusion in environmental areas. What that means is an equitable distribution of resources, meaning that if you are giving this space $50 million, then you give this space $50 million. Or, and the idea, no, that's equality. What I mean is you don't give this space $50 million because they don't need $50 million. They have private donors. They've been getting money for years. But this space that's been doing work in the community for the last 10 years, 20 years, 14 years, doing it on like the last maybe 50K a year, if it's just getting like coats, give them the $50 million because they have a better grasp of what that community needs and they can speak to the like bloodline of that community too. Okay, I'm ready for the next one. So this is just some work from a few case studies I've been a part of. So like I said, I was a part of some research around what happens to young people when they age out of LGBT resources. So we did a focus group where we looked at four groups, 26 participants, and we also did interviews with service providers. And we had questions like, what is it like aging out? How did you prepare for aging out? What is life after you age out? What are the pros and cons of aging out, if so? And what resources have you found? And I think that that term aging out is important because that speaks to a lot of community centers that give resources to LGBTQI youth have a system where most youth will age out at the age of 24. A lot of these youth have been experiencing homelessness or housing instability since the age of 14, 12, you name it. And I had my own experience with homelessness and housing instability, and these were questions I wanted to find out. Was I prepared? I think that I found, and I have a link to all this information. You can go read it yourself, but it definitely spoke to a lot of the inequalities of this resource allocation, and also how you can fold the map in the city of Chicago and you literally could see the difference in how money or resources or de-evolution happens. Um, we can go to the next slide. And yeah, these are just more of my findings. These pictures are also pictures of just places on the south side. This is actually my old elementary school. I got a chance to go inside there, take some pictures, but the south side is super important to me. I love it. I live on the south side. But yeah, just some of my findings. We discussed the roles of like some of the centers and the services that are provided, where more support could be needed for LGBT adults who have been instably housed since youth, and the importance of building those community spaces on the South Side for LGBT people. Thank you for mentioning the Photo Maps Project. I think it's it's really incredible, and it, I don't know, it's just incredible. So yeah, we can go to the next slide. I'm just having a conversation with y'all. So yeah, in conclusion, spatial stigma on the South Side, it definitely has a significant impact. I put pictures of my uncle who lived on the South Side, who died of AIDS complications when I was 10, because he's a huge part of my story and why I do the work that I do. I put a picture of me here at a protest because I'm an activist. At the end of the day, that's who I am. And I put a picture of me when I was in high school, and I think it was the first time I got a group to organize for something I was really felt really important to me and the people around me. And it's a lot of what my conclusion comes to when we think about raising awareness and being advocates and how do we support people in our community. We don't have to really do much. I think, well, we have a lot to do, but when it comes to how we pour into the individuals who are LGBT in part of our families, part of our communities, it's about making sure we are providing an affirming space and making sure that we are demanding when we don't see it, how can we be a part of changing it? Because it's not just up to people in the LGBTQ community to have those spaces that are affirming in their communities on the South Side. It's all of us. So I thank you. I know my next slides have all my resources, and I also, that's for later. So yeah. But if you have any that's all my information. If you want to reach out to me, yeah, I can talk about this in depth, but yeah, it was really great. I hope you all have questions because yeah.
We've actually
And
gotten another a question that's come into the chat, and I'm going to ask people to put their questions into the chat, but we will come back to them after we've finished with the other presenters, and we'll make sure that your question is directed to the person that you'd like to have it directed to. Terry, thank you so much for that presentation. Please put your contact information into the chat so that people can also copy that down and get to it. But wonderful presentation, and I think that you're going to spark a lot of conversation as we continue this evening. I'd like to introduce our second presenter, Gina Lamar Evans, who is the founder and director of services at Nephews. And Gina is going to talk a little bit about what Gina's doing to provide resources for LGBTQIA communities of color, and specifically around not just resources, but also services. And so, Gina, why don't you go ahead?
I was waiting for like a big cheer. Hello, everyone. I am Gina Lamar. No, I'm kidding. First of all, I just have to say after Terry, mic drop. Thank you so much for, initially I was like, were we not in the pre-screen kind of giving you, beef about having slides? Those slides were so important. Thank you so very much. I'm so glad you stuck to your plan. It also it's making me going to do my plan in a minute, but I'll tell about Nephews. I'll do my slides at the end. I just really want to piggyback. There's nothing I can do but piggyback off of what Terry said because it was so powerful. And I don't know how many times to thank you for it. There are things that I always put in order. And one of the things that we always talk about in this space, again, I'm an HIV training specialist by trade. My tagline is I talk about sex for a living because the main mode of transmission continues to be unprotected sex. We figured it out in IV drug usage. We figured it out in perinatal transmission. But when it comes to unprotected sex, we are still losing, especially in the Black community and the LGBTQ community for MSMs and just for Black women even, right? So one of the things that Terry said that, again, I'm just going to keep referring to you because I'm telling you, you set this off right. And I always put it in order because people talk about education. Now, I start with access first. I need access. Don't worry about teaching me about it. Give me access to care. Then give me the science, PrEP and PEP, right? The number of people who have no idea about PrEP at this point. And then routine screening. So I've trained for Maytech years ago. I just finished a world tour for the Academy of HIV Medicine. Okay, it's across 5 states, but felt like a world tour to me, right? And we were saying the same thing, Terry, in every single city. And the further south I got, the more the divide came. So as you talked about the city of Chicago, we know it is one of the most segregated cities in the country. And we're okay with that. And we're not okay with that. We're okay with that in certain senses, because when we meet people outside of here, what's the first thing we say? Where are you from? Chicago. Where you go to high school, right? What side of town? So we still keep it. We keep the segregation going ourselves, right? And what's the real rule, guys? If we meet somebody and they say I went to Glenbard North, we're like, you're not from Chicago. You went to Neuqua Valley, you're not from Chicago, right? Like, and so we have to stop and be cognizant ourselves of how we do those divides. It's a fun thing to do based on your favorite foods, but it's also one of those things that continues to happen. Safe spaces, something you said about safe spaces, and I love it and I appreciate it. I'm always pushing for us to recognize you have to get to that safe space. You have to get to that safe space. And while we try to create a safe space, you have to pass through 3 or 4 territories. And now with people being so transient, you don't even have to be in a bad place. People just drive by and unfortunately can be rude, insensitive, cruel, and make it an unsafe space. So I just appreciate when you said that. The other part that we always say, oh, don't worry, this is a safe space. Confidentiality. Everybody is not should not be privy to your business. I am going to jokingly call you out about telling your uncle's business and stuff. I hope you had permission, right? But we do talk about those things because when you say safe spaces and we say, oh, this is group and it's confidential. No, it's not, because you find the right person to sell your story and they will. And unfortunately, what we don't do is sue. What's the thing with HIPAA? If you tell, I can sue each person you told, I can sue you for $10,000. How many of those lawsuits do we see? And we don't see it from the care that we get on the South Side either, right? So as we talk South Side, I'm so South Side that my agency had to be placed on the South Side. When I do events, they have to be on the areas that I know are most impacted and need the services. So when you also talked about aging out, it just hit home, having done DCFS and recognizing that people will be aging out of the system and what that means on so many levels, right? I even talk about it with parenting. While I'm not a parent, I do say when people are like, oh, at 18, you're on your own. But what have you done to prepare me for 18? And so I think we owe it to the community so that when you're aging out, and you have to be ready for it, right? One of those things is having those conversations. Terry, I appreciate it that you said when we're aging out, how do we transition, what that looks like for us on the other side of adolescence, right? And unfortunately, that happens all across the board because you're no longer the young, tender person, you're the older person, right? And so you have to have those things in place. And it's really important that we keep these conversations. I just appreciate it so much that we keep these conversations going, but we also put some action behind it. When you mentioned about the bigger agencies getting the money, I do have to I'm always for it. I'm a small Black agency on the south side of Chicago at 69th and Wabash, and I am always pushing for us to get dollars, but we have to be prepared for those dollars, right? And I tell people, when you start the protest, you have to be prepared, because if they say, okay, fine, here's $5 million. Those of us who are working and funding, we recognize you can grant me 5 million, but I've got to spend it and be reimbursed. No shade to CDPH, who's a sponsor here. No, I'm kidding. But I say it to people. We have to be put in places where we can cover those dollars until we get that money back, right? And that is always a struggle for us. And so that's one of the things that we have to come to the table together about, pooling our resources, making sure our resources are there together so that we can take those grants, we can demand those grants, and then be in a place and a space to take them. Because what happens is, even if we get them, we still have to push them through a bigger agency, right? And a fiduciary agent, and give them a portion of it. So we still can be losing. I'm going to try to share my screen. I want to make sure that my presentation is up as I do the share screen very quickly and go through these very quick slides. I promise you they're going to be really quick. Let me know if you all can see them, because I do have a video. Can you all see them? Thank you, Natalie. I do have a video that I'm not going to show because it's 3 good minutes. And unfortunately, some of the people who have seen this already are like, really, do we have to watch this again? So those of you who saw it the other day, yes, you do have to watch it again. So my agency is called Nephews, and it's Nephews because I have 18 of them. No nieces, no girls had been born since me for like 36 years. And our family slogan joke is it's named for the nephews, but it'll be run by the nieces. Our motto is CHRIS: case management, healthy relations, retention, intense advocacy, and science. And so, as I was talking about that earlier, I believe in access to care first, science, routine testing, data, right? We're going to need the data for that. Then we can do education. It's named for my nephew, Chris, who I did lose to gun violence. So that's a whole different conversation, but one that continues to happen. Our mission, just a very quick conversation about our mission, is to protect and serve populations who are infected, impacted, and vulnerable to HIV. We opened our doors 4 years ago. As I like to say, I left my good county job and opened my doors in the middle of the pandemic. So I didn't open in the middle of the pandemic. I applied before the pandemic. Then as things started unrolling, I was like, should I still keep doing this, God? Where are we going with this, right? But I do doors home services. I do services, so I'm fee for service. So I'm not a non-for-profit. We are looking, one of the things with the BIA incubator through University of Chicago, we are looking to possibly do a non-for-profit line. So again, we do home services for people living with HIV. Advocacy, really big on advocacy. I always tell people the argument is 10% not of what you said, but 90% of how you say it. Very quick on patient advocacy. My mother was a patient advocate at Cook County for 30 years, and she took complaints on staff and had to write up her coworkers, right? Clearly remember my mother having to write up one of her coworkers who she did rideshare with. And my dad saying, like, you wrote her up and she brought you home. You would have been calling a cab if it were me, right? But what she explained to us is that, you know, it was not about writing up her friend. It was about being the voice for people who didn't have a voice for themselves, right? I will say, now that I'm looking at this picture again, it is pretty dramatic the way I did the picture. We could have done some other stuff for that, but just advocacy. And that's why it's in our agency's DNA plan. I have a sister, my entire family. I always say this with advocacy as we talk about it. My sisters, let there be an injustice, we're fighting for it. One of them is always with the school boards, but my brother very quickly in prison used to write the grievances because he'd say, Mom and Dad, do you believe these guys can't read and they can't write? And my dad was like, yeah, we do. That's why we're very sad you're there with them. And you know, you can do that on the outside. It's called their attorney, right? You don't have to be incarcerated with them. But advocacy is just kind of in our DNA and what we do. So every month, every first Tuesday, I hold candid community conversations, and I do somewhat like this, Dr. Miller, not quite as great as yours. I immediately called my person for candid conversations, like, oh, I love the way I got the email. We got to be in the room 15 minutes early, so it was great. So we do these candid conversations, and we talked about PrEP for Black women. We talked about Mpox. I left it monkeypox because before we did that, we were calling it monkeypox. This is our first PSA that I would make sure that I drop the link in the chat because we don't have time for it. But Ebony Turk did it for us, who did a great job. Like, it's our nephew's first PSA, and we're super excited about it. This is Candid Conversations we do. I'm going to move this over. Oh, so we have quarterly events. It's pretty much just quarterly. We do something called Tuesday Night Tingle every first Tuesday, which is interesting, Terry, because I will be utilizing you now, where we host the community. We do vaccines, testing, and conversation, right? We always have food. We have not been able to get that kicked off the ground after I fought CDPH. Jill is on this call. Anybody who's been on those CDPH calls, when Mpox first hit, I was like, I'll open my doors and you need to do vaccines on the South Side. You do them on the North Side. You're doing them in the bathhouses, which also limits the people who can get them if they can't afford to get into the bathhouse. And so they did. And we have had Rush. We've partnered with Rush and Walgreens for the last couple of years, but we just haven't gotten the numbers that I think we should get, especially with everything Terry said about the South Side. The other part is we do so pretty much something once a quarter, right? We had National Black HIV Awareness Day, our annual Block Club party. I put June 8th. That is so subconscious. That's my mother's birthday. It is clearly June 15th, the day we opened the agency. It happens to fall on a Saturday 4 years ago. We do AIDS Walk, and then every December 1st, we commemorate World AIDS Day, commemorating the lives lost. So here are a few of our activities as they come across that we have done over the year. I wasn't going to even do this, but no. Terry kicked it off with doing slides. So trust me, I'm doing slides. And here's one that my sister is very proud to do, that she pushed the button while the kids were trying to throw the button and dunked me with water. We do things that aren't quite the same. We do coffee and condoms, testing and tamales, chicken and checkups, right? So we veggies and vaccines. Yes, Terry, we do all of that, right? So we do different things just to try to get the community to stop by there. And those are just some of our activities. Just very quickly on our progress, I didn't recognize this until I did this, and that is nothing but God, y'all. They got me here. Okay, and my sisters and my friends. But initially, when I opened the doors in 2020, we only had 20 clients in December. When I left my Good County job, I just assumed I'd take those patients. They were like, no, ma'am, you are not. So I had to start from zero. By 2021, we still only had 75 patients. 2022, 93. We didn't get to over 150 patients until last year. Clients, the state of Illinois calls them customers, which I thought was very insensitive at first. And then they explained to me that they were trying to make state employees recognize that if without them, we wouldn't have these jobs. So I kind of get it, but I was like, so our case notes for the state have to read customers, for AFC clients, for the hospital's patients, right? So we have those conversations. Our money's raised, and when I say money's raised, because we're a for-profit and fee-for-service company, I just meant our money's through AIDS Walk. Like that first year, we hustled, you guys. We got all of that money, right? And somebody said, oh, you start getting more patients and you start getting less money. No, we just got busy, which is really great. We're very grateful for that. But don't worry, we're going to put a system in place where we're going to all keep this money coming for AIDS Walk. And for those of you who don't do it, I'm not, it's not that I'm pushing AFC at all, but it is one of those fundraisers that allows you to raise funds for your agency and get 90% of them back. That's it for me. That's the end of it. And again, our logo changes so that we can know who's stealing it and using it. So you'll see a different nephew almost in every logo. So I am going to stop my sharing. And I just wanted to end with our presentation, just kind of telling you a little bit about nephews and how we do advocacy that way. So thank you all so very much. It is, again, important that we keep these conversations going. And so I thank you, Where's the Love, for having me as we do this.
Gina, thank you so much for that very dynamic presentation. A couple of lessons that I have from your presentation is that in order for an organization to get grants, it needs to be prepared and it needs to have the infrastructure to do so. And so that's a very important message. Ebony Turk has been a participant in our community grand rounds in the past. She's an absolutely dynamic speaker. And so really appreciate the shout out to her. I'm going to introduce our next presenter, Philitha Jones Patterson. She is the Director of Youth Programs and Residential Services at the Night Ministry, and she's going to talk a little bit about what is the Night Ministry and also some of the ways that the Night Ministry is addressing healthcare, poverty, and the in-house. So, Philitha, thanks so much for joining us.
Hello, everyone. Where is the love? I am enjoying all things about this forum. Terry, Gina, amazing. I'm glad I was on mute because I had a few amens in my mind. But yes, so thank you all. Actually, yes, I am Philitha Jones Patterson, Director of Youth Programs, Residential with the Night Ministry. Our pronouns are she, her, hers, and I wanted to elevate, hopefully a little bit more, echoing the large part of the conversations I've heard around this very important topic of just lack of resources. My specialty, I don't know if it's special, but it's special to me, is youth who are experiencing homelessness and being unhoused and left on the streets. If we know that there's 4.2 million young people who experience homelessness in their lifetimes, and then Chicago is actually meeting a number that is startling when it comes to young people who are unhoused or living couch surfing, coming into shelter programs such as the Night Ministries. I am going to share my screen to talk a little bit about the programs that we provide at the Night Ministry, and then I can go into a little bit about like how that looks with services. So if that's okay. So Night Ministry has an array of programs. If you've probably seen our bus come to the south side, west sides, and all that, you've seen the Night Ministry Outreach Health Ministry bus. But for the purposes of this program, I'm going to be talking a little bit about youth programs. The programs that we have in our continuum are our low barrier shelter programs. That's an overnight shelter program called the Crib. Effectively named by the young people to say, hey, we want to go to the crib. They don't want to be talking about, hey, we're finna go to a shelter. So they say, we're going to the crib. And they named it for themselves. And also the interim housing program, which is our 16-bed shelter program for young people ages 14 to 20 years old. It's a 120-day stay or more, depending on if we can get them housed. But again, low barrier, 24-hour case management services. And our Parenting with Purpose program, which I should be clicking slides, but I'm a little bit behind, so I'll start here. So our youth outreach team meets young people on the street, meets young people in libraries, meets young people on trains, because the face of homelessness for youth is not that of a typical folks that are experiencing homelessness in a chronic way for adults. Young people are kind of woven into the society and really have leaned into being unseen. We want to elevate that. They need to be seen, they need to be heard, they need to be advocated for. So our youth outreach team goes out to make sure that they can identify young people who are homeless and try to get them into services. As the Crib, as I was speaking of, so this is our actual crib space. We're located at 1735 North Ashland. One of the great things about the crib space is that it's, again, low barrier to young people who are experiencing homelessness. Actually, when we were in Boys Town, we have migrated since to this area. But one of the primary reasons the crib was even launched is to be able to create safe space for people who were LGBTQI plus young people who found themselves homeless and wanted to be in a safe environment. So again, a safe and supportive overnight emergency shelter. Young people can come as early as 7 o'clock. They have meals, they can meet a case manager, they stay, provide all things, hugs, love, hygiene, what you need, a bed, a safe space. And we're open 24/7, 365 nights a year. In the increment weathers, we open up even during the day, but we also partner with Broadway Youth Centers, Center on Hosted, where young people can go during the day for drop-in centers. So that's a really good partnership for us. Our interim housing program is one of the programs that I oversee. This is actually the space, again, 14 up to 21 years old. You can have children, you can not have children, you could be LGBTQ. We want to create brave space, safe space for our young people to come and access services. That is one of the lack thereof. Young people who are in this age group should not find themselves unhoused. Unfortunately, they do. The intersectionality of being LGBTQI exacerbates that number by far. So you have young people who are not only trying to figure out life, figure out just being a young adult, or maybe not even that, and then find themselves unhoused because of rejection, foster care aging out of systems of care and not having that familiar community support. And while they're trying to be resilient, we still need to figure out ways to create community that is impactful and allow young people to get the learnings through life skills, all those things that I heard us talking about. Like, we can't just say you're 18 and you're grown. You're not grown, you of age, as I tell the young people in our spaces. So the support for the youth and their families to return home and just to access appropriate housing. So our longer term residential programs include our Pathways Transitional Living and our Parenting with Purpose and our Flexible Housing Pool. Our Parenting with Purpose program offers young moms a program up to 18 months. And that program particularly is for young people 16 to 20 years of age. The hope and goal is to disrupt not one, but 2 or 3 generations of homelessness, if you know that young people are young mothers. So that's the Parenting with Purpose program, which was established in 2007. I was there to launch that program. I've been with the Night Ministry 17 years. So we've been trying to do this work a long, long, long time. But I've been doing lots of work in youth homelessness in all areas for 25 years. So what I wish is that they would create opportunities that I don't have a job, but while homelessness is here and it seems to not be going anywhere, I'm unfortunately fortunate to be able to serve in this capacity, but we want to eradicate this issue. So again, we're going to talk about renovations. Our Pathways transitional program, and it's on the west side. It's a Greystone. We wanted to try to figure out how to now migrate. One of the things that Terry was echoing is like the redlining and just where access to services from where the communities that our young people come from, LGBTQI, find themselves having to migrate oftentimes north to figure out services. We want that not to be a lack of resources in the communities that they come from. I can recall when we were at the crib and being in Boys Town, while it was free and fair, being African American, young men and women and anything in between, you still had the same issues of being policed and NIMBY, serve them, but don't serve them in our community. So those intersectionalities just make it really, really hard for young people, especially our subpopulation of LGBTQI young people, to be able to feel safe and brave and get employment and all those things. So we want to, again, I appreciate the university of elevating this conversation. Our flexible housing pool meets the needs of young people who are living in apartments in the community and serve 75 plus households. But I'm not going to bore you with more slides. All of our programs have case management connection outside. But what I think I like to say at most and at best is that we like to build real lifelong transformative relationships with young people. And I'm gonna stop sharing to get back to seeing the faces. I love seeing the faces. So how do we combat these issues? We have to elevate the conversation as we're doing today. We have to make an awareness. Again, young people who are trying to just navigate spaces at their tender ages. But I love the fact that with the night ministry, we want to be that extended arm of like extended arm of support. Like, I'm cousin, I am chosen family. I am, we want young people to feel like they have that. So I auntie a lot of the young people in the space. So we want to elevate community and build relationship that offers and fosters a lot of support for all of our young people, and not make this this a thing where we know that BIPOC people are overly represented in the homeless population. Again, exacerbated by like another subculture group, but it's not a subculture. This is who we are. And so takes for us that represent and have voice and advocacy. And the last on the call that I was on, I loved hearing, that we don't want to only be like allies, we want to be commandos for this group. So I am really, really interested in how to continue this work, meet all you great folks on the call, and talk about how we can continue to do this work. And that is my presentation.
Belitha, thank you so much. And being commandos and foot soldiers in this fight I think is extremely important. You also answered a question that I had from Terry's presentation, which you talked about the issue of NIMBY and the services that are available in the community, and also the fact that so many of these young people are being over-policed. And so even though they may want to go and to get services in the community at a place like Center on Halsted or places on the north side, it's like, oh, you're not supposed to be here because this is not for you. And so thank you so much for addressing that question. Our last speaker for this evening, before we open up the floor for questions and comments, is Ryan Mack. Ryan is a diversity, equity, and inclusion training specialist at the University of Chicago Medicine, and he's going to talk a little bit about the importance of, I'll short phrase it and to say DEI, diversity, equity, inclusion, for our LGBTQIA communities of color, and also talk a little bit about the work that you're doing at the University of Chicago Medicine around this issue. So Ryan, thank you for taking the time and spending some time with us this evening.
Thank you, Dr. Miller. I'll try to keep my comments brief. I don't have a slide. I don't have any pre-planned presentation. I really just came thinking I would offer the resources that we have at U Chicago Medicine and let you know what is available on one hand, and on the other hand, just offer some additional thoughts and comments about where is the love and how to distribute resources and think about what we have to offer as a sociologist and gender scholar. So as Dr. Miller said, I'm from the Urban Health Initiative's Office of Diversity, Equity, and Inclusion, where I'm a training specialist. I help co-facilitate the cultural competence course for the University of Chicago Medicine, which I think am I correct that most of the audience here today is as U Chicago Medicine folks, or are we from across the city? I sit in on so many things and on so many panels that I'm not necessarily sure who the audience are going to be. So like when the question of like, where is the love in communities of color comes up, I'm like, I have some ideas, but who is the audience here and who am I speaking to? And like, I don't need to tell people things they already know if they already know them. So in any case.
It's across the city, Ryan.
Okay,
so
great.
Don't have
okay,
to worry
great.
about it. Yeah. Broad audience.
Feel free, even if you aren't at U Chicago Medicine, to reach out to me at any point after the conversation or to tap into the resources that we have available to offer. It's really nice to be invited to speak at something like this. So I'm a training specialist. I help co-facilitate the cultural competence course. At U Chicago Medicine, our trainings sessions really focus on skill building. So really direct skill building. I'm trained as an academic and a sociologist. And when I started at U Chicago Medicine, learning how to teach the cultural competence course, I was really quite satisfied with how directly applicable each of the sessions were. It wasn't like an hour of information that was sort of interesting, but sort of how do we apply that? What do we do with it? It was real skill building. It was really about focused on negotiating worldview differences or interrogating your own implicit bias. So it's really satisfying and unique as a cultural competence series and as an Office of Diversity, Equity, and Inclusion for, I think, being really scale focused. So I'm really like proud to be a part of that and proud to be sort of under Joel Jackson, who I think I told last minute I would be pitch hitting for. So that's who I'm sort of representing here as a member of the Office of Diversity, Equity, and Inclusion, Joel Jackson and his work, and wanting to let you know a little bit about that. So in terms of the resources available at UCM, we as the Office of Diversity, Equity, and Inclusion have a number of skill building and cultural competence courses that we offer. We also just developed a caring health services session for LGBTQ plus folks that is an hour long, which is a really exciting. And as a gender scholar, I'll tell you that it's one of our most didactic sessions where it's like, here's just a bunch of information and terms. And I tell you, every time I have facilitated it, like the wide-eyed thirst for just what sometimes can feel like a simple base level of knowledge has been astonishing and really informative. Like I live in a sort of gay world in a gay neighborhood with gay neighbors, and I research gay and lesbian things, and have like my whole world is LGBTQIA health and care, right? And so to like realize that, oh, there are just like some basic opportunities to get comfortable with terminology, feel like water to the thirsty out there has been really interesting. So that's an hour-long session that we have available that is really, really interesting. We also, one of my roles as a sort of specialist in LGBTQIA stuff at Chicago Medicine for the Office of Diversity, Equity, and Inclusion is to compile our submission for the Healthcare Equality Index, which is the Human Rights Campaign sort of institutional review of healthcare institutions to say, are they doing a good job with LGBTQIA care? And they are the ones that designate us a leader in healthcare for LGBTQIA folks, right? And so I was part of my job is to compile all of the things that we do for patients, for employees, the services that we have for the community, how we go about them. Are we doing a good job with the actual care for both patients and employees? And are we being unshy and publicizing our enthusiastic support for LGBTQ folks? So those are the two main like objectives of the survey. And it's really comprehensive. It's long. It was a summer-long, almost full-time project to sort of see what are we doing? Are all these baseline policies in order? Are we keeping up with the current needs of trans people and their healthcare needs? How are we doing it? Are we letting our trans employees know how our policies for their healthcare support them? So that's the kind of stuff that I'm up to navigating, and it's huge and comprehensive. And I'm sort of really proud to work for Joel Jackson, who says, yes, this is something the hospital wants. Like the hospital wants to be certified a designated leader, and the C-suite wants to tell people like, we are doing a good job with these things that we all as a field care about being fair and offering good healthcare, right? And so Joel Jackson says that's what they want. And so we want to use these standards to help press the hospital towards actually being a leader, towards meeting the needs of trans folks in the ways that they really need and that they're asking for. So I'm really proud that he like takes this designation and uses it to hold the hospital accountable too. And that we're in an interesting position where we can do that. I think sort of as part of the community health wing of the hospital and not necessarily as part of the HR wing, we have sort of some unique strategic opportunities to leverage certain kind of things in weird ways. So that's the kind of stuff that we do in the Office of Diversity, Equity, and Inclusion. And it's really been an interesting, I've been here for 2 years working with Joel, and it's been quite a treat to see him operate with integrity towards the larger mission of the community while still be strategic inside of the hospital and institutionally at the same time. He's the best resource. That's the resource we have. We have Joel Jackson as a resource. In any case, I'm happy to answer any questions or talk about anything. I feel like I want to leave plenty of time for other people to respond and answer questions. I have plenty of other thoughts that I'm sure will emerge if and when they come up in the question session.
Ryan, thank you so much for that presentation. And also, I just want to note that because of the programming that takes place in this space at University of Chicago Medicine for several years in a row, we have won awards from the Human Rights Campaign, if I remember correctly. Is that right?
Yeah, yes, that's who gives us that leadership designation from the Healthcare Equality Index. So we're a designated leader from the Human Rights Campaign. That's exactly right.
Yeah. Thank you. So very important information. Well, I'm going to open up the floor for questions, and I've actually got 2 questions in the chat already. I'm going to go back to one of the earlier ones and then scroll down a little bit, but also to encourage everybody that's on this Zoom call today to please continue to put your questions into the chat. So this is a question that was directed at Terry, but I think that actually our other speakers can speak to this as well. And very provocative question. I really respect it and appreciate it. And the question is, do you think that Southside resources that are given to large community-based organizations are not well received because they give Southside people secondhand assistance? Okay, so comparison of what's happening on the north side versus the south side. The question of, Terry, I think you spoke to this, old buildings versus having brand new multi-million-dollar centers that are built up. And so, Terry, did you want to speak to that? And also, I'm going to direct that to you too, Gina, as well. So, Terry, you go first.
Yes, I'll definitely speak to that. Whoever asked that question, thank you so much for asking. I think that's an amazing question. One, I want to say that again, I've lived in Chicago my entire life. I am someone who had to get services from the crib. I had to get services from the night ministry, all the youth programs, and now I'm in the on behind the scenes. And what I will say is, in my last 15 years of being a recipient of servants and now working in it, I haven't seen ground broken in the way that I've seen it broke on the north side when it comes to building spaces. I will say in the last 5 years, there has been 2 spaces I know about built in almost the same neighborhood. And I don't think it's the fault of these spaces because these spaces offer some incredible resources. But when you look at the population of people and where they are coming from who directly need some of these services, like a youth space that caters to Black and Brown youth, that's on the north side. They're coming from west side communities, they're coming from north side communities, and it's hard, I think that it shows people who are part of that community how much they matter. It also speaks, I'm glad you said it feels secondhand when those resources get allocated when they are on the north side, on the south side. It is the thought that you should be grateful for what you got, and I have been a person who has been met with that, being a person who's been poor, being a person who's received food from a food pantry. You are not meant to ask for more. That is the message that is being sent. And that's something I'm firmly in believement in. And I just want it to be known that like you can break ground on the south side and build some really incredible spaces. We have done it before. We've seen it happen in um even the spaces that don't build in like break ground, they do it without it. And they do some incredible work. Gina, me and you definitely we're gonna connect. But yeah, I want to give somebody else an opportunity to speak.
Thank you. Gina, I'm going to turn that question to you, and then the next question is going to be for Philippa. So Gina, go ahead.
I don't have anything to say. Terry once again said it all, but no, really, there's always something to be said about. You're absolutely right, and thank you for that question. I think it came from you, Elliot, about us being secondhand and being just grateful for what we have thus far. Right? I'm gonna say it. I mean it. And it gets really, really tough to have to hear. Right? But we keep thinking that it's better on the north side. And it's not necessarily. I'm not taking anything from the north side. I'm just saying it's where our resources are. People have told me, patients have told me, I feel safer up there when I'm traveling to and from there because of Boys Town, right? And things, happening there. This is a tough one to have to say as well. When you talk about resources, Terry, you have to follow, you know, how that happens. And I'm not ever accusing anyone of doing anything intentionally, but what happens is when you're at the crib, Aletha, I'm coming for you, at the crib on the north side, and you're up there getting services, and you're at the shelter on the north side, when you get tested or when you receive services and you put a north side zip code, there's no way when I look at zip codes at client level data that you can convince me that we have that many young Black MSMs living on the north side. We do not. If I ask everyone to give me their ID, it's got their grandmama's house on the south side, on east side, in Chatham, in South Shore, on the west side. But what happens is when I'm getting tested, when I'm asking for services, you put those zip codes down, and that gets captured as data, and it looks like we need those services for young Black MSMs on the north side that I guarantee you, I'm sorry, I'm saying it, do not live on the north side. That's it.
Not a sorry, Gina, not a sorry. It is a truth. And
So true.
It is one of the things that, as a provider, is a real thing. And even when we're thinking about young people who are getting longer term housing options, they typically want to live in the communities where they come from, right? But because of resources and lack thereof, they feel like they have to migrate and go to the north side or stay north to be able to just access those services. So yeah, that is something we're here for where's the love and to elevate the lack of resources. So even knowing that and making that a point, we have to do the work and advocacy to get those services where the services are needed.
Thank you. Aletha, the next question is for you. Let's say if a 21-year-old comes in for housing and they're going to turn 22 in 6 months, how does that work in terms of helping to get that 21-year-old, almost 22-year-old set up for housing?
Well, depending on the program that you're in within our continuum. The crib actually is ages 18 to 24 years of age, but there is it's a real sad reality that young people age out of those systems of care. As Terry was talking about, there is an age limit, but we also offer aftercare. So what we try to do, especially when it comes down to our interim housing program, I can speak more specifically about within that time frame. If it's our 120-day stay, we don't say at 121 days you got to go. We say you stay until we can figure it out. Like, we're going to try to figure it out. Just being able to just work within our parameters of like age and all those things, but we want to be able to at least try to serve you and to the last of what we can, and then not just pass you off into other systems of homelessness. So City of Chicago does have an open resource, so where we're trying to make sure that we know partnerships, make calls. The coordinated entry system is something that we utilize. While that was a great addition to the court to coordinate entry system. However, we still have more work to do because there's not a lot of beds available for youth. So that's where we are. Again, lack of resources, lack of beds. Young people want to find like long-term housing. So if that's not returning into returning to family or identified family, that's where we want to be able to identify, like maybe you live in a community, creating your own. We have championed and watched young people build their own systems of eco mapping around young people, like living together or roommating. So those are just ways that we try to circumvent returning young people to homelessness.
Thank you. Gina, you've got your hand raised. You wanted to make a comment or had a question?
I do want to make a comment. And Aletha, thank you so much for that. But as we're talking about this, aging out at 22, that's strategic. Right. That's strategic. We have to figure out which one it is. If I were a well-financed, typical kid, I can stay on my parents' insurance until I'm 26 because we acknowledge adolescence, right? So we have to align all of those things. with it when it comes to community, when it comes to policing, when it comes to sentencing. Either I have an adolescent brain or I don't, right? And just once again, you know, some people are able to say, oh, I did that in college. I mean, yeah, I did do that, but that was in college when I was 24. But for Black people, for young Black MSMs and for young Black people, period, right? They are treated as adults very early. So aging out at 22, what do I have at 22? It's almost like the 18 again thing again, right? So we just have to make sure all of these things align with when adolescence ends, when housing ends, when insurance changes and ends, and also with sentencing. I just had to say it. Thank you.
Definitely, Gina. I am amen and again. So yes, young people who are aging out, Black and brown young people are overly represented in systems of care. Foster care systems saturated. 2 times that of those that are in that represent LGBTQI populations. When you can be adopted and the city, not the city, I'm sorry, the state is your care provider, and then you reach a certain age, we're really not doing a really good job with foster care exit plans. So those young people become shelter young people because there's no way to continue to have that added support. It's not just about the dollar. Like what is the relationship you're building? I don't want to like take a dig on child welfare. Well, you see how old I am. I said child welfare, youth and care programming, but we have to do better at making sure that we are following, affirming, creating real relationship and not just transactional relationship with young people, because I have young people I already dated myself, that's 35, 36, that still call me from programs that are like, Miss Felipe, and you still? Yes, I am, because I'm still auntie, right? So we want to create those spaces for young people that do not have the typical family. And if you think about, as Gina, you were mentioning, and I don't want to, I'm just passionate about this work. When you think about that, when young people turn 18, and you're saying, okay, if you're college ready, I have young people in my own house that ain't ready. So what does housing ready look like? They don't have a skill yet. So just to be marginalized because of your identity, on top of being victimized because you are Black and brown people, we have to do better as a community. I'll stop there. Sorry, Dory.
That's no, Felipe, you're fine. Thank you. Terry, I'm going to let you make your comment because we actually got some other questions that are coming up in the chat, and I want to make sure that we get to them before we start to close out. So Terry, go ahead and make your comment.
I'll make it very quick. Felipe, like everything you said about the aging out, I'm a person who was adopted and I've went through some of the similar stuff. I also in the chat, I put those articles where the research around aging out and spatial stigma. I encourage anyone who's interested to go read it. I'm very passionate about it and can talk about it for hours. But yeah, thank you for I want to give other people opportunities to speak.
Thank you. I'm going to take a comment on something and take it out of order. So and respond to a comment that was dropped into the chat, and that is about the aging LGBTQ population. We're actually going to be doing a community grand rounds on aging issues that's going to be coming up. I believe it's in March. Is that correct, Natalie? You shaking your head? Yes.
March 21st.
Okay, so thank you for putting that particular issue on our radar screen so that as we're planning for that particular community grand rounds. So I'm going to go back up to the questions, and this one has to do with, and Ryan, I'm going to address this one with you as a sociologist, and that is, does social isolation because of stigma lead to increases in substance use? So we're talking about drug use, we're talking about alcohol use, and frankly, even cigarette smoking. So what have you found?
I think the relatively straightforward answer is yes. I mean, I don't know. Like, obviously, as a sociologist, I'll make all of those annoying academic caveats that, like, we don't know about causality, but the correlations are strong, you know, like isolation and feeling lonely is associated with some kinds of increased substance use.
Okay.
For sure. Yeah.
Thank you.
Yeah.
And then Falitha, in terms of services that might be provided at the night ministry, because you mentioned in one of close to your closing slide that you also make referrals to the people, to organizations that might be able to address these things. Does substance abuse come up for you and some of the young people that you work with, and do you have resources to support them or have connections to resources?
Yes, linkages with all partnerships are really, really critical to just the continuum of care for young people. I do want to say just not this subpopulation is impacted, like young people are using lots of ways to deal with their trauma. Just homelessness in itself is a trauma. Just for the sake of this call, I mean this forum, the fact that there is not a lot of therapists of color, young people want to be able to identify, to hear. Not everyone is going to have access. Only like 39% of people of color, LGBTQI represented youth will even access mental health services. So that is one of the ways that continue to like make young people have issues with like just wanting to even talk about what they're going through. So I think that we want to elevate the need for service providers that reflect the populations that they're serving. Hopefully that answers your question. Oh, and we do try to make as many referrals as we can. There's very limited resources. We need more intentional resources, more affirming resources that can help everyone, but more specifically this marginalized group.
Very important information to hear, particularly working at a health center at like the University of Chicago. There's a comment from Allison that's more of a comment around some of the needs that are in community. And so I'm going to ask people if you've got access to the chat to read that, because we've got another question here that is, I think is very interesting. Do you run into circumstances of not in my backyard working to set up resources on the south and west side? So I think to some extent, Terry, you refer to this in your comments around people being on the north side, but what about communities on the south and west side? If you could comment about that.
So in my experience, it's the idea that there are so many, there's two minds. There's the idea that, well, I don't know anything about this, but if y'all want to go and have something there, if it helps people out, then go ahead and have it. But the larger idea is there are already Black people in this community suffering. And usually that's where I'm having the conversation that like, I'm Black, I'm queer, and I also am paying a lot of money in rent, I also don't have access to fresh food, or like nice stores or resources for mental health. I think that it's a large part about showing that, when we talk about the Black community and the resources, it's not just LGBT people, but those are the people who are most affected by those lacks of resources, and it's not saying that the other portion of the population doesn't need them either. We all need it. I think that my focus has been, I see this marginalized community, part of another marginalized community lacking resources in a way that the resources exist, but not in their own areas and not even for people that exist there, and I think that that's a large part of a lot of conversations when I go into community and I'm doing engagement about like HIV screenings or why it's important to have these services. I'm met with questions like, well, we need like, rental assistance, or we don't understand how to fill out these applications for funding to build this space. And I think that that's really important to hear, because a lot of times those are some of the same issues, they're very parallel to one another. And I think that it's me being there like, yeah, well, I want to attack that too. Like, that's exactly why, we should be working together. I think that it was something said earlier around like getting youth to spaces where, like I love the idea of getting people to spaces where these resources are there for emergencies, but they are not lifelines. And a lot of times they become lifelines. And I look at things like how many youth programs offer tuition assistance, because not every youth does not want to go to college. College is not an option. I'm a person who is 30 and I had to work myself to a place where I'm finally an undergrad. And, you know, every resource program could give me a place to, sleep, give me some food or anything. But when I ask for like, I want to go to college, I want to get a degree so I can enter a different social economic status, that didn't exist. I already had my high school diploma because I was adopted and I aged out at 18. I didn't have anywhere to go after that. So I was working through all those systems and I'm like, who's going to help me pay for school? Those are some things I think about, or like, who's going to have these conversations so like young people don't have to be like homeless? I think a large part of it is having these conversations on the South Side so that we don't get to these scarcity of resources. But yeah.
I think that's incredibly powerful and important information. And one of the comments that was dropped into the chat, I think, is another drop the mic comment, and that is so you can elevate. So thank you so much for putting that very powerful comment into the chat, because it's not just about surviving or thriving, but it is about being empowered, having the power to be able to take your life to another level. And so I really do appreciate that comment that you just put in there. I would like to thank our guest for this evening. This has been a wonderful, robust conversation. So again, much appreciate the time that you spent with us, both our discussants as well as our audience. I'm going to turn things over to Natalie, who's going to tell us about next steps.
Yes, so thank you everyone for joining us. First, our next step will be, I will put a link to the survey in the chat. You can click that link and take the survey. You don't have to stay logged in. But I also will remind you again in the coming days to take the survey. But I wanted to also, as mentioned earlier, we will be hosting another community grand rounds on March 21st at Claretian Associates, one of our partnering organizations in the South Chicago neighborhood. The topic will be Let's Get Active, Improving Isolation and Loneliness in Our Older Adults. We will be in person, so there will be food and a lot of fun. I'll make sure that that information gets to all of you as well. But again, thank you for joining us, and hold just a second so I can get that link in the chat for you. And again, once you open the survey, you don't have to stay on. You can log out and just take the survey. But I will remind you in a couple of days. I have your email addresses.
Natalie, thank you so much. This has been great.
Thank you.
Thank you all for having me. Yes.
Yes, thank you so much. This was incredible.
Yes,
It's
it
also
was.
so good seeing so many familiar faces. Like, I missed all of you all.
So my link is saying not working. Yeah.
It didn't open the link.
Your link is saying not working. Let me do it again.
Yeah.
Do it again.
We had this issue before. Let me copy it this way. See if you can get into it now.
Yeah, it's open now.
It open now? Perfect.
Yeah.
Thank you.
Thank you.
All right.
Terry, so good to see you.
It's good to see you too.
Yeah.
I was definitely going to say, if you got 55th, definitely stop by. I'm usually over here.
Oh, okay.
Yeah, I'm on the 3rd floor.
Oh, I will.
Mm-hmm.
I will.
Have a good evening, everybody.
Good night.
You too. Thank you,
Good
Dr.
night.
Miller. Thank you, Natalie.
You're
Thank
welcome.
you.
Good night. Thank you, everyone.
Good night.